Welcome to Ask Mo TV. We are here today with Dr. Michael Wald, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine of Mount Kisco, PC. Our topic today is detoxification and alkaline. How do toxins in the body come to exist? Why and how are they harmful to a person's health?
Well, first of all, by definition, a toxin is something that's bad. It's something that negatively impacts how the body works and can interfere with virtually any cell, tissue, or organ system in the body. There are toxins that are made in the environment. They're known as exogenous toxins, or toxins from the outside. And then there are toxins that are produced within the body, known as endogenous toxins. And over the course of a lifetime, toxins can accumulate. And depending on one's genetics and other factors, toxins can create virtually any health problem whatsoever. So the body naturally has ways of detoxing or detoxifying the body. And the organs of detoxification, most people are familiar that the liver is the major organ of detoxification, but the lungs are also detoxification organs, as are the kidneys, the skin, and all of these organs and others work together to rid the body of various toxins. Some toxins are best eliminated through the urine. Others are best eliminated through the digestive tract, through the colon, and through the feces. And certain other toxins are eliminated through the skin. But it's important to realize that certain toxins cannot be eliminated any other way other than the ways they can be eliminated. So, for example, mercury cannot be detoxified through the skin, even though there are all sorts of claims of low-temperature saunas and ionic foot baths that claim that you can remove toxins through the skin. That's not possible. The metals are far too large to fit through the skin. So when one's thinking of how to remove toxins, you have to first determine what toxins are you speaking about. And then the different types of detoxification method would need to be based correctly on the toxin or toxins in question.
What is the approach of integrated medicine with regard to the removal of such toxins?
Again, depending on what toxin or toxins we're speaking about, the person who's doing the detoxification, along with the client, health professional and client together, need to be mindful of the method of detoxification. So, for example, I used the mercury just a moment ago. Mercury is best detoxed through the stool. So nutrition and foods that promote colonic health or colonic elimination would be more important than, let's say, detoxifiers that would support the kidneys or the cardiovascular system. So it's very important that when people hear and read about the best detoxifiers or this detox tea or this herb, it can't be true, because the detoxifier to be best, you have to know what sort of toxin you're speaking about.
Why is the pH balance of a person so important?
Yeah, the pH balance, this is one of my pet peeves. pH refers to the relative acid or alkaline balance in the body. Almost everyone listening to a video like this has heard that being alkaline is better. Somehow it's better for health, and it's anti-inflammatory, and it reduces cancer risk, and if you have cancer, you want to be alkaline. Well, that sounds great, except it's meaningless. That's because we have to first ask ourselves, where are we talking about being alkaline? We're supposed to be alkaline in our mouths. We're supposed to be acid in our stomachs. We're supposed to be slightly acid in our colon. Our urine pH or acid-alkaline balance should be slightly on the acid side. Our venous blood has a different alkalinity, acidic balance than our arterial blood. So what are we talking about when we say we should be alkaline? Where? So let me cut right through it for you. When we're talking about acid and alkaline, you should be thinking about the blood, because the blood is very rigidly controlled within a very tight pH. The blood pH, or acid-alkaline balance, should be between a 7.3 and a 7.35. Very, very tightly controlled. Many practitioners use saliva and urine pHs, but those pHs change extremely dramatically from minute to minute. Literally jumping up and down for 3 minutes will change the pH of both your saliva and urine. So basing an entire acid-base balancing lifestyle, a protocol, a nutritional, plan on those pHs in those tissues is a mistake. So you want to visit a healthcare provider that does venous pH testing so that you can determine if your diet and your nutritional supplement endeavors or total healthy lifestyle approach are correctly managing the pH of your blood, of your venous blood. However, depending on what health problem you might have, let's use the example of cancer with spread, what's known as metastatic spread. Studies have shown that if you keep the blood on the alkaline end, meaning the pH should be somewhere between 7.4 and higher. The difference between, by the way, 7.3, 7.35, which I said a moment ago, is the normal venous pH, and 7.4 or 7.45 in pH language is astronomically huge, and that's been shown to reduce cancer spread. But on the other hand, if you're concerned about pH and you happen to suffer from seizures, you don't want to be alkaline in your blood at all. You actually want to be slightly acid, because being slightly acid in terms of circulation to the brain reduces seizure activity. So we need to be very mindful of what we're trying to manage in terms of health issue and what the pH should be in those particular instances. And also not assuming that just because you're eating a certain way, you're eating alkaline, or you're eating more acid, or you're juicing your juices, that you're actually going to be acid or alkaline in those different areas of the body I just mentioned. So it sounds a little complex, but that you might want to listen to this video more than once, because I rarely hear these facts about pH discussed.
This has been Dr. Michael Wald.